take a family that's already struggling to try and figure out life, and then you give them something to help them, and then you take it away.
Families of children with disabilities might see restrictions to their state services starting next month. The Arizona Division of Developmental Disabilities is making changes to its policies on attendant care and habilitation services for those younger than 18.
13 News reporter Kayla Butter joins us live now. And Kayla, you spoke with a family who will be affected by these policy changes, right?
Yeah, so under new changes to DDD's assessment tool, the state will no longer assess the needs of children with disabilities under the age of 10 years old. Now that means that families of these children will no longer receive payments for their attendant needs. 2-year-old Lennon Novinsky was diagnosed with Batten disease, a terminal neurological disorder, just about a year ago.
After her diagnosis, it was 6 months of rapid regression, so she lost the ability to walk and crawl and talk and eat by mouth.
Shortly after Lennon's diagnosis, her now 16-month-old sister Elliot was diagnosed with the same disease.
Probably in about 6 months, she'll be at the same point as Lennon.
Because Lennon and soon Elliot require around-the-clock specialized care, Novinsky says her family relies on attendant care payments from the state.
Having this as another resource just to kind of buffer what we were making made it possible for me to stay home and be with Lennon. But now with the new cuts, we are forced to be living on one income.
The new policy changes are required by the funding legislation House Bill 2945 that saved the DDD from running out of money last spring. In a joint statement to 13 News, Access and DDD said in part, quote, "The upcoming revisions are designed to ensure services are delivered in a clinically appropriate, equitable, and cost-effective manner. They are also intended to meet federal requirements and comply with Arizona state law." Access and DDD also say that they've seen a significant increase in the use of attendant care among minors in the state. According to numbers by the Department of Economic Security, within the past year, there was a more than $140 million increase in money spent by the state on attendant care for those under 18. Still, Novinsky says that the way DDD went about the change is not right, especially considering she was made aware of the changes that will take effect on October 1st last week.
Cuts are real and they affect families in real ways. And to cut from the most vulnerable of our population just doesn't seem fair.
In a statement, the DDD told me that they are currently working in collaboration with Access and the governor's office to provide solution to these families that are being affected by these changes. Reporting live in Tucson, Kayla Butter, 13 News.